If you open your medicine cabinet tonight and pick up a small white tablet labeled Atorvastatin, or Lipitor, you are holding one of the most widely prescribed substances in medical history. Millions of seniors swallow this pill every single day, trusting it to protect their hearts and keep their arteries clear. But if you have noticed that your legs feel unusually heavy when walking up the stairs, or if you find yourself staring at the kitchen cabinet, trying to remember why you opened it, your body may be trying to communicate something critical. You might have laughed it off as a simple senior moment. You might have assumed that muscle soreness is just a normal part of getting older. But these subtle shifts in your daily vitality are not always due to the calendar. Most people think these changes are just signs of natural aging. The research suggests a different reality. It points to the specific biochemical ways that atorvastatin interacts with your liver, your muscles, and your nervous system. While this medication is highly effective at lowering your bad LDL cholesterol and stabilizing plaque to prevent cardiovascular events, it also alters downstream metabolic pathways that affect your cellular energy and brain chemistry. For a small but significant group of adults over 50, these secondary effects can manifest as muscle discomfort, fatigue, and memory slips. Please take a moment to share this video with your family and friends. Many seniors live with these silent side effects without ever realizing their daily pill could be the trigger. Sharing this information helps them understand their symptoms and empowers them to have an open, informed discussion with their healthcare providers. Let us build a supportive community together. Please write in the comments below how many years you have taken a statin and if you have noticed any changes in your muscle comfort or memory focus. We read every response. Many adults assume that if they tolerate a statin well in the first few weeks, they are completely free from side effects. But the real physiological shifts often accumulate gradually, with symptoms appearing months or even years after starting the drug, or within 4 hours of taking your daily dose. Tonight, we will examine the 9 specific warnings every senior needs to know about atorvastatin. We will show you what is happening inside your cells, and how to protect both your heart and your daily quality of life. Our first warning sign is one of the most concerning for seniors: new, sudden gaps in your short-term memory. Consider Linda, a retired school teacher who took pride in her sharp recall and active reading schedule. A few months after her doctor increased her atorvastatin dose to 40 milligrams, she began losing her train of thought mid-sentence. She would walk into a room and stand confused, completely unable to recall what she was looking for. Her daughter noticed she was asking the same question multiple times during their weekly phone calls. Linda feared she was experiencing the first signs of irreversible dementia, but the timing pointed to a different cause. Here is the biological connection. Your brain is the most cholesterol-rich organ in your body, containing about 25% of your total cholesterol. Cholesterol is a vital structural component of myelin sheaths, which insulate nerve fibers, and is essential for the formation of synapses, the connections that allow brain cells to communicate and retrieve memories. Atorvastatin is lipophilic, meaning it is fat-soluble. This property allows it to cross cell membranes easily and cross the blood-brain barrier. Once inside the central nervous system, it can reduce cholesterol synthesis in brain tissue. In susceptible seniors, this transient reduction in neural cholesterol can disrupt synaptic transmission, leading to short-term memory slips and cognitive confusion. The relationship between statins and cognitive changes is well documented. In 2012, the United States Food and Drug Administration officially updated the safety labels for all statin medications, including atorvastatin. The agency added warnings regarding reports of non-serious reversible cognitive side effects, including memory loss, forgetfulness, and confusion. The label notes that these symptoms typically resolve within weeks of stopping the medication or reducing the dose. The second warning is a persistent feeling of brain fog or mental slowing. Unlike a distinct memory gap, brain fog feels like trying to think through a heavy mist. You might find it harder to follow complex conversations, lose your focus while reading, or struggle to calculate a restaurant tip. Many seniors describe it as a feeling that they are simply not as sharp or fast as they used to be, and they normalize it as an expected part of aging. This mental cloudiness is often tied to cellular energy. When atorvastatin blocks the cholesterol pathway in your liver, it also blocks the production of coenzyme Q10, a vital compound that your cellular engines, the mitochondria, use to generate energy. Your brain cells require massive amounts of energy to function. When mitochondrial energy production drops due to CoQ10 depletion, your brain cells cannot process information at their normal speed. This energy deficit manifests as mental fatigue and brain fog. Our third warning is one of the most common physical complaints, a feeling of heaviness or symmetrical aches in your muscles, particularly in your thighs, hips, and shoulders. This is the story of James, a senior who walked 2 miles every morning. After starting atorvastatin, his legs began to feel like concrete. The muscles in his thighs ached symmetrically, making simple walking feel like a major physical effort. He assumed he was just developing arthritis or growing frail, so he cut his walks in half and spent more time sitting. This condition is known as statin-associated muscle symptoms, or SAMS. It occurs because the depletion of coenzyme Q10 and other vital compounds in your muscle cells disrupts mitochondrial function, leading to muscle fiber damage and inflammation. The pain is typically symmetrical, meaning it affects both sides of your body equally. This helps distinguish it from localized joint pain like osteoarthritis, which usually affects one side or one specific joint more than the other. Clinical reviews indicate that while severe muscle breakdown is rare, milder muscle aches and weakness affect up to 10% of patients in real-world clinical practice. This muscle weakness can lead to a gradual decline in daily physical activity, which accelerates muscle loss, reduces cardiovascular fitness, and increases the risk of balance issues and falls in older adults. The fourth warning is a sudden, unexplained drop in your daily energy and a feeling of chronic fatigue. Seniors may notice that they are waking up exhausted, even after a full night of sleep, or finding themselves completely wiped out by early afternoon, needing long naps just to get through the day. This is not the gradual change in energy that happens over decades. It is a distinct step down in your physical stamina. The biological mechanism is systemic mitochondrial dysfunction. Because coenzyme Q10 is a key electron carrier in the respiratory chain of every cell, its reduction affects not just your muscles, but your entire body. Your cells are running on a depleted fuel supply. This lack of cellular energy is experienced as overall physical fatigue and a lack of stamina. It is like driving a car with a partially blocked fuel line. The engine runs, but it cannot produce normal power under load. Our fifth warning is waking up in the middle of the night with intense, painful muscle cramps in your calves or feet. Consider George, who began experiencing severe calf spasms that woke him from deep sleep multiple times a week. The pain was so sharp that he would have to jump out of bed and pace the floor to stretch the muscle. He blamed dehydration, magnesium deficiency, and poor sleeping positions, trying various home treatments without success. While muscle cramps have many causes, statins can increase muscle cell membrane excitability. The combination of mitochondrial energy depletion and altered electrolyte transport across muscle cell membranes makes the muscle fibers more prone to sudden, involuntary contractions. This excitability is often worse at night, when the body is at rest and circulation in the limbs slows down. Waking up with new or worsening leg cramps shortly after starting atorvastatin is a clear sign that your muscle tissue is reacting to the drug. The sixth warning is a rise in your fasting blood sugar. Her doctor noted that her HbA1c had risen from a stable pre-diabetic level of 5.8% to 6.5%, crossing the threshold into type 2 diabetes. Margaret had not changed her diet or gained weight, and she could not understand why her blood sugar was suddenly climbing. The mechanism behind this rise is twofold. Statins can decrease the sensitivity of your body's cells to insulin, meaning glucose remains in your blood longer instead of being absorbed by your muscles for fuel. They can also affect the beta cells in your pancreas, which produce insulin. This slight reduction in insulin secretion and sensitivity can cause blood sugar levels to rise, particularly in seniors who already have prediabetes or metabolic risk factors. Large clinical trials have confirmed a small but clear increase in the risk of new-onset diabetes associated with statin use, especially with high-potency statins like atorvastatin at 40 or 80 milligrams. However, cardiologists emphasize that the cardiovascular benefits of statin therapy in preventing heart attacks and strokes generally remain far greater than the risk of blood sugar elevation. It is a trade-off that requires careful tracking, not immediate discontinuation. Our seventh warning sign involves persistent digestive upset, upper abdominal discomfort, or changes in your routine liver function tests. Atorvastatin is metabolized primarily in your liver. For most seniors, the liver handles this process without issue. However, in some individuals, the drug can cause inflammation of the liver cells, which can present as vague nausea, mild loss of appetite, or abdominal discomfort. This inflammation causes liver enzymes, specifically alanine aminotransferase, or ALT, and aspartate aminotransferase, or AST, to leak into your bloodstream. Your doctor tracks these enzymes through regular blood tests. A mild rise in these numbers is relatively common and often temporary. However, a significant elevation to 3 times the upper limit of normal is a clear signal that your liver is experiencing stress from the medication and could require a clinical adjustment. The eighth warning is the hidden danger of drug interactions, often called the cocktail effect. Atorvastatin is processed in your liver by a specific enzyme pathway called cytochrome P450-3A4, or CYP3A4. If you take other medications that use this same pathway, or if you consume substances that block this enzyme, your body cannot clear the statin normally. This causes the level of atorvastatin in your blood to rise dramatically, increasing the risk of muscle and cognitive side effects. Grapefruit juice is a classic example of this effect. It contains compounds that temporarily disable the CYP3A4 enzyme in your small intestine. If you drink grapefruit juice while taking atorvastatin, you can absorb significantly more of the active drug than intended. It is like taking a double or triple dose of your medication. Many common prescriptions, including certain blood pressure drugs like amlodipine, specific antibiotics, and antifungals, also interact with this pathway. Seniors taking multiple medications must have their full list reviewed for these interactions. Our ninth warning is a sudden step down in your overall physical or cognitive function shortly after a dose increase or a change in your medication brand. You might notice that a senior who was previously independent, driving, and managing their home begins to struggle with daily tasks, complains of feeling off balance, or shows a new reluctance to go out. This sudden change is often temporally linked to a change in their prescription. When a doctor increases the dose to achieve a lower cholesterol target, the higher concentration of the drug can overwhelm a senior's metabolic capacity, particularly if their kidney or liver function has naturally declined with age. This increased exposure triggers a cascade of muscle weakness, fatigue, and mental slowing that looks like sudden aging but is actually a dose-related drug response. If you or a loved one are experiencing any of these warning signs, it is vital to approach the situation systematically. Do not stop taking your atorvastatin cold turkey. Doing so can cause a rebound in your cholesterol levels and increase your risk of cardiovascular events, especially if you have a history of heart disease or a previous stroke. Instead, prepare for your next medical appointment by starting a daily symptom log. Write down the specific symptoms you notice, the exact time of day they occur, and how they relate to the time you take your medication. Document the severity and how the symptoms affect your daily activities. If you experience muscle pain, request a creatine kinase, or CK, blood test to check for muscle injury, along with a routine liver function panel. This data provides your doctor with objective evidence to guide your treatment. Your doctor has multiple strategies to address these side effects. While still protecting your cardiovascular health, they may suggest lowering your atorvastatin dose, switching you to a hydrophilic statin like preventative or rosuvastatin, which does not cross cell membranes as easily. or moving to an alternate day dosing schedule. They might also discuss adding non-statin medications to lower your cholesterol, or supplementing with coenzyme Q10 to support cellular energy. Let us return to Linda, the retired teacher who struggled with memory gaps. After discussing her symptom log with her physician, they decided to reduce her atorvastatin dose and switch her to rosuvastatin, a hydrophilic alternative. Within a few weeks, the mental mist began to clear. She was once again able to follow her book club discussions and balance her checkbook without difficulty. Her bad cholesterol remained well controlled, and she regained her confidence. While managing mild side effects is a gradual process, you must know the emergency thresholds. If you develop severe, progressive muscle pain accompanied by dark, tea-colored urine, seek immediate medical care. This combination can signal a rare but serious condition called rhabdomyolysis, where broken-down muscle proteins enter your blood and can injure your kidneys. If you experience sudden chest pain, shortness of breath, or signs of a stroke, like slurred speech or weakness on one side, call emergency services immediately. Your body does not send symptoms randomly. By learning to identify these warning signals and discussing them openly with your doctor, you can protect both your cardiovascular system and your daily quality of life. Start your symptom log tonight and have that conversation at your next visit. Thank you for watching.